Hi, let's talk about the muscles of facial expression. In this video, we'll discuss the various groups of facial muscles, how they're
these muscles
distributed
are
about the
innervated by the
face, their
seventh cranial
functions,
nerve,
and their
facial
innervations.
nerve.
So,
when you're testing
the superficial
patients'
muscles
cranial
of the
nerves
head
and
are
you get the cranial
divided
nerve
into
number
two
7,
groups.
you ask them
The
to wrinkle their
epicranial
forehead,
muscles
to
are
close
those
their eyes
muscles
as
which
tightly
are
as they
upon
can,
the cranium,
to show
and
you
the
their teeth by
craniofacial
making a
muscles
smile,
are those muscles
and
of the
asking them to puff
cranium
their
but
cheeks out.
associated with
So this
the
is
face.
a crude test of the
The
muscles of facial
craniofacial
expression.
muscles
So the way I'm
can
going
be
to do
grouped
this
according
tutorial is
to
that I'm going to
the
start
orifice
superiorly
that they
and
control.
work
So, for
through
instance, surrounding
various
the
muscle groups in the
orbit
face, so the
and palpebral fissures
orbital
are the
muscle group,
circumorbital
the
and
nasal
palpebral
muscle group,
muscles. Surrounding the
and then the
nares
muscles
and nose
in the
are the
oral
nasal
region.
muscles, and surrounding the oral fissure,
So to
so
begin
the
looking at the
labia
most
and the
superior
buccal
muscle
or
in the
cheek
face,
regions are the
you can see this
buccolabial.
muscle here, which is the frontal belly
So let's
of the
take this group by group.
occipitofrontalis muscle.
So the epicranial muscles
And it's
are
called the
more
occipitofrontalis
diverse
muscle,
than
but
what will be
consists of
discussed
two
here,
muscle
but
bellies.
the major
So you've got
epicranial
the
muscle
occipital
is the
muscle belly,
occipitofrontalis muscle.
so-called
Occipital
occipital region of
frontalis,
the
frontal. So
skull.
those are the two bones
And you've got the
that these muscles
belly,
are going to
occipitofrontalis.
attach to.
And connecting these two muscle bellies, you've
We
got
can conceptualize the
flat
occipitofrontalis
tendon,
muscle
this
as
aponeurosis.
one large muscle with two bellies,
And if you've
frontal
covered
belly
the layers of the
and
scalp,
an occipital belly,
you'll have been told
with
that
a
the
large
aponeurosis of the
epicranial
occipitofrontalis
aponeurosis
makes up
between
the
the
third
two.
layer of the scalp.
Or we
So
can
you've got the skin
conceptualize them as
connected
two
tissue,
separate muscles,
aponeurosis,
the
loose connective
frontalis
tissue, and then the
and the
periosteum.
occipitalis.
So the aponeurosis
For the purposes of this video, we'll
occipitofrontalis
treat them as the same muscle with
is the third
different
layer of the scalp.
innervations. So when active,
So
the
if we just look
occipitofrontalis
at the
muscle
orbital
is
region,
going to elevate the brow. So
you
it
can
gives
see
this
these
look
muscles which
of
surround
surprise,
the eye.
perhaps slight
And this muscle is
condescension,
called
depending
the
on how you want to mix and
orbicularis
match this.
oculi.
So
And
the
it's acts
the
as
greatest
a
amount of
sphincter of the
movement
eye,
and
and you've got
expression
an
here
outer
is
part
generated by that frontal belly.
and an inner
That
part
frontal belly
to this muscle.
is innervated by temporal branches
So this outer
of
part
the
here
facial nerve.
is called
And
the
posterior to that
orbital
frontal
part,
belly, we have a very
and it's
large and
responsible for
robust
closing the eyelids forcibly.
cranial aponeurosis, which we can also see
I'll just zoom
here
in
as
a
well.
little
This
bit
can be
more.
very, very extensive.
You can see that
The occipital belly is usually
the
smaller than the
orbicularis
frontal belly, and we
and
can
this
see that here.
is called
And
the palpable
typically on
part,
cadaveric
and it
specimens,
resides
it might be
inside
very
the
hard to
eyelid,
see. It
and it's
tends to
responsible
atrophy
for
and
closing
go
the
through a
eyelid
process
gently.
of fibrosis with age. So if you don't see a very
So that's the
well-developed
orbicularis
occipital belly
oculi,
of
this
occipital
circular
frontalis,
muscle
it's not the end
responsible
of
for
the world.
closing
It's
the
probably quite
closing the
typical.
eyelids.
The interesting thing
So the
is
next
that
muscle
occipital belly
is this muscle
is
here, the
innervated
corrugator
by
supercilii,
a different set
and
of
it lies
branches
just
versus the frontal
deep
belly.
to the
So that
orbicularis
occipital
oculi,
belly is innervated by
and
an
it draws the
occipital
eyebrows
branch of
medially
the
and downward.
posterior auricular nerve of the
There are
facial
three
nerve. So
muscles
that
associated with
nerve
the
that comes out of the
nasal
stylomastoid
muscles of the
heading
face.
back that way.
And
So
the
it's
nasal
going to
group.
innervate the occipital belly.
So you've got the
It's also going
procerus,
to innervate
you've got the
posterior
nasalis, which
auricular
consists
and
of a
sometimes
transverse
even
part
superior
and an alar part. And you've got this muscle of the midline, which is called the depressor septi nasal. So the procerus muscle,
moving on to the
here on either
craniofacial
side,
group,
originates
let's
on the nasal
start
bone
superiorly
inserts
and
onto
work
the
our way
skin
down.
of the forehead. And this
Orbicularis
muscle is active when an
oculi.
individual frowns.
So orbicularis oculi. Let's break that down.
And
Muscles
these
can be
muscles
named
here,
a
the
variety of ways. Sometimes
nasalis,
they're
which
named
consists of the
for the
transverse part
attachments
and
or
the
the regions
alar
that they
part, is
overlie.
responsible for
Sometimes they're
compressing
named for
and
the direction of
flaring the nostrils.
their muscle fibers or their fascicles.
So the
And
transverse
in this
part
case,
compresses the nostrils, and the
it's a little
alar
bit
part,
of that and a little bit of
the alar
region.
part of the
So
nasalis,
orbicularis means
helps flare
that
the
the
nostrils,
muscle
it
fibers
opens them
are
out.
arranged in a circular.
And this muscle here, the depressor septi nasal,
And
So
oculi
the name kind of gives
refers to the
away what
eye.
it does.
So this
It
is the
depresses
muscle
the nasal septum,
with
so it draws the nose
circularly
down inferiorly.
arranged fibers that
So
overlies
it
the
actually
eye.
inserts
And there
onto
are
the
three parts to it.
nasal septum.
There's the orbital part.
And it assists the alar part of the nasalis in widening the nostrils. So those are the three muscles of the nasal group of the facial muscles.
That orbital part is what
the
voluntarily and
nasalis
forcibly
and the
closes
depressor nasi
the palpebral fissure.
septi.
The palpebral part, that would be everything within.
So the next group of muscles is the
that
oral group of muscles. And as you can see, there's quite a lot of muscles which make up this group. So if you're not interested in learning about all those in detail, then I'll just cover the two muscles that you need to know, and you can switch off after that, and then if you're interested, you can carry on listening
voluntarily
to find out about the other
but
muscles.
typically
So what you need
is
to know in the oral
under
group,
involuntary control. So
if you're only going to learn two muscles,
blinking
is
is a function of the palpebral
big
fissure.
muscle
You
here
don't
which
spend most of your day
forms a circle
thinking,
around the mouth.
time to lubricate the eyes. So
And this is known as the
we have that going
orbicularis.
for us.
So just like you've
There's
got the
also a
circular
third part of this
muscles
muscle
around the
which
eyes,
lies
which
deep here in the
constrict around the
medial
eyes,
area,
the orbicularis oculi.
by the
You've
medial
got
angle of the eye,
orbicularis
called the
oris.
lacrimal part. And this
So
is
in Latin,
overlying the
oculus
lacrimal
is an eye,
apparatus so as to
and
squeeze it
os,
to create
oris,
pressure
is
draw
a mouth, so orifice, oris.
Now,
You'd remember that.
all
So
parts of this
orbicularis oris
muscle
is
are
circular mouth,
innervated by
circular
both
muscle, which
temporal and zygomatic branches of the facial.
circles the mouth.
So one of the landmarks
And you can
that
kind
I
of guess
use
what
is
the
the
function is.
lateral campus.
When it contracts, it
So
narrows the mouth
we'll
and
have
closes the
temporal
lips.
branches
So you get this
above
pursing
and
action,
zygomatic branches
which you get when you're
below.
whistling, and that's brought about by this muscle,
Now,
the
deep
orbicularis
to
oris.
orbicularis oculi,
and the other muscle
deep
you'll
to
need to
the
know,
frontal belly of occipitalis
which lies deep to these
is a small
muscles here, is
strip
the
of muscle called the corrugator supercilii. Corrugator supercilii.
Do these exercises with
So this is the superciliary region, and corrugator, to make corrugated, this is a furrower of the brow. So when this muscle contracts, like so,
I'm speaking in general about
it pulls the brow together.
Palsy
This is an action that people will take involuntarily when they are confronted with bright light. So this can be paired with squinting. So along with orbicularis oculi, you can contract the corrugator supercilii so as to provide your eyes a little bit more shade. This is also something that sometimes involuntarily gets paired with a disdainful feeling that you might have for an individual. Considering this photograph was taken indoors, obviously this person is acting, but this kind of looks like perhaps the recipient of the gaze is in a little bit of trouble. Corrugator supercilii is innervated by temporal branches of the facial nerve, so everything above there would head
on the front 2/3 of the tongue and some.
Next up, the buccolabial muscles. So we're going to skip over the nasal muscles ever so briefly to turn our attention to those muscles that are associated with the oral fissure. So there are several here, and one of them is going to be in that nasal group, and we'll come back to this one. This is one of my favorite muscles. Levator labii superioris aliquinazi, but let's begin with this muscle here, levator labii superioris. Levator labii superioris is just inferior to orbicularis oculi. It's going to the superior lip or the upper lip, and when levator labii superioris muscles in tandem, so let's say we have both of these firing at the same time, that is going to elevate the upper lip, hence the name. We also have moving lateral zygomaticus minor. Zygomaticus minor is over the zygomatic bone, and there are two of these, and so the smaller of the two gets the name minor. Zygomaticus minor, when it fires, is going to pull the lip superiorly and laterally. So we have kind of an oblique vector there. And it is going to uncover the teeth to about the canine. So there is, let's see, central incisor, lateral incisor, canine. It just barely bears the canine. Sometimes the zygomaticus minor is present, sometimes it's absent, sometimes it can be indistinguishable from zygomaticus major, so those two muscles can go together. Nevertheless, you know, if it's there, wonderful. If it's not, it's not the end of the world. Moving laterally, we have the zygomaticus major. Zygomaticus major is overlying the zygoma, or the zygomatic bone. It is larger than the minor. We can see here that both of these muscles are coming down to participate in the modiolus. That's that interdigitation of fibromuscular tissues that is controlling the angle of the mouth. So what we have are a series of muscles that are going to contribute to an ever-widening smile. So, levator labii superioris elevates the lip. Zygomaticus minor is going to expose to the canine. Zygomaticus major is going to go beyond the canine, as we can see there. So, when used in sequence, we have an ever-widening smile. So, how wonderful there. All compliments of what these muscles do to the upper lip and that modiolus. Control the modiolus, and you control the mouth. These three muscls are all innervated by both zygomatic and buccal branches of the facial nerve. So zygomatic and buccal branches of the facial nerve. Deep to these muscles, along with levator labii superioris aliqui nasi, is that infraorbital or canine fascial space.
Botox. How Botox works? Botox is injected with a very
the muscle of oral fissure facial expression is going to be orbicularis oris. This is the money muscle in terms of social media photography. So orbicularis, those circularly shaped fibers, oris of the oral fissure,
the injected muscle has diminished
would be this muscle here. So this will be deep to and surrounding, deep to the skin of and surrounding the superior and inferior lips. And when contracted, this purses the lips. So if you think about that full-lipped ducky face that people make when they take selfies, that's compliments of orbicularis oris. And orbicularis oris is innervated by buccal branches. So we've got buccal branches coming across, and marginal mandibular branch of the facial nerve. Next up, the buccinator muscle. The buccinator muscle is the deepest of all of the facial muscles here. So it's originating or attaching to that pterygomandibular raphe. And it comes and it is going to attach to the alveolar surfaces or ridges surrounding both the maxillary and mandibular teeth. So this is really forming the muscular wall of the cheek. When contracted, the buccinator muscle is going to push anything in the oral vestibule deep. So that's going to bring food into the occlusal surfaces or between the occlusal surfaces of maxillary and mandibular teeth for eating, which is a nice thing to do, right? It's helping the muscles of mastication by bringing the items to be masticated between the teeth.
Surprise
The
and
buccinator muscle
astonishment.
is
Even
interesting
people
in
who
that
are
it is
blind
pierced
from birth produce
by the
these
parotid
same
duct, and
expressions.
superficial
would
to it
seem
we have a
that these
very
emotional
robust and nice
manifestations
buccal fat
not
pad. So
simply
we can see that
acquired, but
buccal fat pad
are
here
innate.
in the cadaveric image. We can
In
see
general, let us
parotid duct
continue
moving across and then diving
about
deep
speaking about
into what
the
would be the
muscles, the
buccal
anatomy,
fascial
muscles,
space.
Nerves, and
So that
all
buccal fascial space is traversed
about
by
muscles of
Stenson's
facial
duct, or the parotid duct.
expressions.
Coming
So,
through this
muscles of
space
the
is
human
the
face and
buccal
neck,
branch
highly
of
important for
V3.
non-verbal
So the maxillary division of the
communication,
the
which
mandibular division of the
helps
trigeminal nerve
show
sends
emotion.
the buckle nerve
Humans have
anteriorly through this
muscles in the
space
face
to
that
afferently
permit a
serve
large
the skin
variety
of the
facial
cheek and also
expressions
some of the
because the muscles are
gingiva
used to
surrounding the
show
molars.
surprise, disgust,
Very
anger,
frequently,
fear,
this
and other
this buccal nerve
emotions.
is referred to as the
They
long
are
buccal nerve
an
by
important means
clinicians.
of non-verbal communication. Muscles
Now,
of
we
facial
also have
expression
a
include
couple of
frontalis,
other muscles
orbicularis,
controlling
oris,
the oral fissure.
laris,
Life can't be
oculi,
all smiles,
buccinator,
and so
zygomaticus.
well, in this case,
That's
we're not
all.
done smiling.
Let us
Deep
continue in another video.
to the levator labii superioris is the.
Fine.
So here we have that levator
I will
labii
post,
superioris
a picture
is the levator
which shows,
anguli
the
oris. So here, coming from the
physiologist,
modiolus up to the maxilla,
Benjamin
deep to levator labii superioris is levator anguli oris. It's an elevator of the angle of the mouth.
Muscles using
so it's
current through
enabling a smile. This muscle is innervated by buccal branches of the facial nerve, as it should be for that region. We also have a highly variable muscle, the risorius muscle. Risorius muscle may be present, it may not be present. It goes from the modiolus out laterally, superficial to that buccal fascial space, and when it's activated, it pulls the sides of, or the angles of, the mouth laterally, so as to produce a smirk. And like levator anguli oris, risorius is also innervated by buccal branches of the facial nerve.
The orifices and act as
now, some of the frowny muscles.
muscles.
Let's start with depressor anguli oris. Depressor anguli oris is originating from that, or I should say, attaching to the modiolus and going down to the mandible there.
In general,
depressor depresses the angle of the mouth, so it pulls the angle of the mouth inferolaterally. And this muscle is innervated by both buccal branches of the facial nerve as well as the marginal mandibular branch of the facial nerve. We also have depressor labii inferioris muscle. Depressor labii inferioris muscle tends to be deep to depressor anguli oris. And this muscle, when working in concert with its counterpart, is going to depress the lower lip. So pull it downwards. We also have the mentalis muscle. The mentalis muscle is in the mental or the chin region. And when active, the mentalis muscle is going to produce a pout by both elevating and protruding the skin of the chin. So by pulling this chin skin upwards, it displaces the lower lip to produce the pout. And mentalis is innervated much the same way depressor labii inferioris is by the marginal mandibular branch of facial. Now, the nasal muscles, starting with one of my favorite facial muscles, the levator labii superioris aliqui nasi. So let me trace this muscle for you. It's going to blow your mind. So levator labii superioris, it's going to elevate the superior lip which it does. And there's also this little slip of muscle that goes to the ala, or the wing of the nose. That's the area above the nostril. So elevates the upper lip and also the wing of the nose. So levator labii superioris aliquinasi is going to dilate the nostril and elevate the upper lip. So I kind of think of this as kind of like the Elvis snarl, if you're familiar with the King of Pop. And this muscle is the longest named muscle of any human muscle. So if you're ever at a trivia night and you're asked what the longest name of any muscle is in the human body, it's levator labii superioris aliquinasi, which is innervated by both the zygomatic and buccal branches of the facial nerve. Next up, we have the nasalis muscle. The nasalis, or just the nasal muscle, has two parts to it. Sometimes these parts are given their own muscle name. So we have one part, the transverse part, that is over the body of the nose here. So running along the bridge of the nose, down laterally. Now, when that contracts, it actually constricts the nares. And so that transverse part, when given its own name, is called the compressor nares. There's also another part from the alar region that when it contracts, it pulls the alar region outwards. That's the alar part, also known as dilator nares. So compressor nares and dilator nares are antagonistic to one another, and both are innervated by zygomatic and buccal branches of semen, which makes sense. And this leads us to our assessment question, and that would be, which muscle may both elevate the upper lip and dilate the nares? So elevate the upper lip and dilate the nares. Let's see, levator anguli oris, that's going to pull the modiolus superolaterally, so that's a smiley muscle. It's not really an elevator of the upper lip, though. So levator labii superioris, that definitely